To fully grasp phage therapy being an alternative to antibiotics, we must first understand what it is. When it comes to phage, the figure that is shown in front of us shows a formation of an icosahedron head with 20 faces and 30 edges, with a tail and fiber legs. The phage's DNA is within inside the icosahedron, but passes through the tail when penetrating the host. With what the phage is, it is also known as a bacteriophage, which is a type of virus that infects bacteria. Bacteriophages kill and selectively target bacteria through a process called lysis. Because phage is a virus, it requires a host to replicate its DNA and RNA, which is why phages successfully kill its host. The process consists of bacteriophages assembling and bursting out of the bacterium, destroying their host. They are the most common biological entities in nature that effectively target and destroy multi-drug resistant bacteria. After fully grasping exactly what phage is, when it comes to phage therapy, it is potentially the therapeutic use of bacteriophages to treat pathogenic bacterial infections. Bacteriophages, known as phages from the previous slide, are a form of viruses. That virus attacks certain bacteria, but are considered to be harmless to animals, plants, and people. Although they are considered to be the natural enemy of bacteria, they do not affect the good bacteria that we have naturally in our bodies, which makes it a good alternative to antibiotics. The history of phage therapy consists of a few different people, within the first person being William Torts. Bacteriophages was first discovered in 1915 by him, William. The first to observe the bacterium phenomenon, although wasn't William, was actually a French-Canadian microbiologist, Felix Dehern, in 1917. He continued his work and began to test his phages in human patients, administering them into a 12-year-old boy with a severe case of dysentery, which is an infection of the intestines resulting in severe diarrhea with the presence of blood and mucus in the feces. Within that administration, that young boy resulted in a complete recovery after receiving bacteriophage therapy. The first administration of phages was actually given officially in 1921 at the Hospital of Paris. Phage therapy has potentially been acknowledged after that first case with that boy having a severe case of. How does phage therapy work? Within phage therapy, it consists of a cycle. That cycle focuses on the bacteriophage killing bacteria by making them burst or lyse. That occurs when the bacteriophage penetrates that specific bacteria and transfers the DNA or RNA from that phage into that to replicate its DNA and to potentially make it burst and destroy it from inside out. So that process would indicate it beginning with the virus infecting that bacteria by injecting its genes, so the DNA or RNA. The phage virus copies itself, reproduces inside that bacteria. New viruses in each bacterium. Finally, the virus breaks open the bacteria, releasing the new bacteriophages. Bacteriophages can only multiply and grow inside a bacterium, so it needs a host. Like any other virus, it does not replicate itself as it needs a host. Once all the bacteria are lysed, or in other words dead, they'll stop. Phage versus antibiotics. Within the idea of using phage therapy as an alternative to antibiotics, we must first look at the advantages phages have as well as what advantages antibiotics have, and to see if it would be a good alternative. Within phage, it is found everywhere, and there is more phage on Earth than any other organism combined, so there is an abundance regarding getting phage. Bacteriophage is extremely specific regarding its target and only targets and kills one type of bacteria bearing. So far, there has not been any side effects reported within using phage therapy. They replicate at the sign of infection, so that means that bacteria hits the points that it needs to hit, within the idea of using phage therapy to attack that specific bacteria. Good alternatives for patients allergic to antibiotics, as well as auto-dosing. Phage during the bacterial killing process are capable of increasing the number specifically when hosts are located. Within looking at the advantages, there's also challenges within phage therapy. Although there's a lot of potential, there's a lack of studies done on phage therapy. There's also a lack of understanding within what phage therapy is, as there is a pie chart describing if there is any understanding. I myself did not know what phage therapy was until this project, so it was pretty interesting to know that there is a lot of potential but not enough studies. It is expensive to study more intensively. There is a failure within the use of phages, as it is kind of an abundant resource, so you have to look at what bacteria you're trying to hit and what you need to get that bacteria. Since it does attack one specific bacteria, you have to make sure you have that specific bacteria in mind when using phage therapy. So yeah, within the idea of the challenges that come with it, there is a need for more studies, a need for more understanding of what it does, and an understanding of